little chat. What is the one piece of advice that you would give to young doctors who are still in medical college, who or even aspiring doctors who might be thinking of joining the medical profession?
So medical profession is and will always be a noble profession. It's like teachers who actually build the future citizens. As I said, this body is an ever-changing computer that God made. And then he brought in doctors and nurses and medical fraternity to help these bodies to get polished, because we polish our shoes and they shine and we feel proud about it. Similarly, as medical fraternity, as medical teams at this glory hospital where I live and work in around long hours, I know we polish this part of the world with safer health, better health, give them the quality of life that they deserve on two diseases altogether. One is those life-threatening diseases, other is the quality of life diseases, which I deal with regularly. When I look forward to individuals who aspire to be doctors and then aspirants beyond that, because today medical field is just not the MBBS. It's beyond that to specialize, super specialize, cater to the requirements of the day and your achievements, and probably your aspirations to take those niche areas, which is obviously a space age in terms of never-ending time. Be committed because you will have long years and decades of training and teaching. Your colleagues in various other specialties may be by the time earning and probably having a family and be able to live a dream. It is important for you, if you're committed on this subject, you will need to spend some time. You need to spend long years to be able to specialize and to be able to be confident enough. Confidence is not about speaking from a stage. Confidence is about able to execute the work given to you, expected of you, which is coming your way at odd hours, including unearthly hours. So it's important for aspiring doctors, aspiring specialists, aspiring super specialists to take this journey to the next level completely. That means they should be capable enough to be able to handle something in front. There's a lady who actually came in from Agartala. Her daughter is born with MRKH syndrome. We can talk on this for a while because this is awareness for
Yes,
public.
yes, yes,
And
yes.
the girl at the age of 12, 14, and 16 years was not having menstrual periods. They went to a gynecologist and they did some sonographies and were found to having a missing uterus and missing vagina. And she obviously has ovaries. So her secondary sexual characters look very good. She's grown up into a young girl, a beautiful young girl who's growing. Parents take consults from doctors, colleagues in that part of the world or any part of the world, and she is born with a disability which is not visibly external. Externally, she looks as beautiful as the most beautiful woman on earth, but internally, she is unfortunately incomplete woman. Why I tell you this is because we need to play roles of kind which actually matters to the individual in front who's needy and whose needs have to be fulfilled in the gamut or the very perimeter of health, science, and ethics. That I've gone into very many niche area subjects only by training, teaching, by learning. I've been being very selfish in learning because learning is a daily journey. Learning cannot be stopping at a one point in time. Our teachers still say that we are learning every day. I go to probably teach and train, but I learn myself and come back. So this lady probably landed up from the YouTube channel you talked about when she read about MRKH syndrome, and the girl had turned 24. So from 15, 17 years, hunting for something to happen for the girl to be as good as the sibling daughters that she had, who had regular menstrual periods. The elder one had got married, the younger one was good enough. And this interspersed girl, who actually was as beautiful as anybody else, was actually missing out life because she could not be a complete woman. So by default, they landed up here at the Kokilaben Dhirubhai Ambani Hospital. That I do this subject called MRKH syndrome out of the reconstructive urology and pelvic health that I do, from the open surgery to the robotic surgery. We gave her a robotic sigmoid vaginoplasty. Which other words, we gave her an organ which probably, sadly, by default, she had missed out at birth. We did not give her a uterus, but we gave her a vagina. She is now a complete woman. She has got married to the partner. She will have a child by a surrogate pregnancy. And a mother thanked me enough and sent a small piece of letter saying that we pray every day. I have never seen God, but out on earth, probably by default, I saw somebody who could change a life. So, in other words, saving somebody in a trauma or saving a child who has got a torsion testis at 1 o'clock at night, where the testis turn around. And if you don't derotate it in time, almost always by a surgical exploration at unearthly hours in time, the testis loses a blood supply and then is all going to be removed and put in a dustbin. The
Mm.
testis is gone. And this does happen not at your and my age, but in the growing years, when the testis is growing and going to hang, and at the time as the testis becomes more heavier, any kind of a strenuous activity in the cremasteric muscles in some patients where the bilateral or both sides testis may still not be fixed to the bottom of the scrotum very well, can rotate, and one rotation by a sudden onset muscular activity, be straining at stool, straining at football, turns and twists and give you a sudden onset pain in testis called torsion testis, could actually change the life of the parents who went to a general practitioner and probably took antibiotics thinking it's an infection, and wake
Mm.
up a day or two later when they come too late and the testis has to be removed. Compared to somebody who has got a pain 1 hour ago and rushes to the emergency department at 2 o'clock, 2 a.m. to the Kokilaben Hospital. The emergency team is geared and knows what to do. They rush him through the ultrasound department, showing that the blood supply is weaning off and getting lost, and to the operating room where we explore the scrotum, derotate the testis, fix it up. His life saves around. And this boy requires the testis to grow as a male in future. Is such an important aspect. So frankly speaking, if I look into the awareness part, I look at doctors of tomorrow to be stronger than the doctors of today. That means whatever I do, I'm sure my juniors would emulate and probably make it bigger. You know, all the records are made to be broken. Be it Brian Lara, be it Gary Sobers, be it Dhoni, be it Tendulkar, the records need to be broken. That means in an era today with technology, era today with time, era today with commitment and passion, there are many more Sanjay Pandays who will probably beat the entire aspect of continued long hours, long days, and long destinations of being able to bring about subjects of care and cure with a lot of passion and purpose. It has to be taken forward in that way.
Oh, Dr. Sanjay Pandey